Still to come on First Cast, this is a kidney stone. Coming up in a live interview, we'll tell you why you're more likely to get one in the summer than any other time of the year. Nobody wants to hear the word kidney stone when they go to the doctor, but unfortunately it happens for men and women, right? Too?
Everybody.
We're joined this morning with Dr. Koushik Shaw with the Austin Diagnostic Clinic to talk a little bit about kidney stones. Dr. Shaw, tell us first, who does it affect mostly? And it's pretty interesting that you can get it more likely in the summer than any other time of the year.
Right, Jenny. About 1 in 10 people in their lifetime might actually develop a kidney stone, so it can be pretty common. And men and women can develop them. And the most common age is usually anywhere between 30 and 50 years of age. Certain people are more predisposed to kidney stones if you have a genetic or family history. And then on top of that, whether you're Randy riding his pony out there or everyone doing the Capital 10K tomorrow, as we get dehydrated and other things like that happen, we can actually make stones more viable and actually more common, especially in the hot summer months when we get dehydrated.
So obviously drinking affects your liver, and everything goes through the kidneys there, that kind of gets filtered out. Would drinking alcohol also tend to give you a kidney stone more often than not?
Right. Anything that gets you dehydrated tends to make kidney stones more common. And just like we have the sun belt, urologists actually refer to that same area as the stone belt, for the same reason as there may be certain impurities in the water, plus people in those areas tend to do a lot more outdoor activities, get dehydrated with alcohol, lawn mowing, running, etc. And as that happens, the urine tends to concentrate all the minerals and deposits, and those gradually stick together and form a kidney stone over time.
We were just looking at some images there of some close-up shots of a kidney stone. What were we looking at?
Basically what you were looking at is a small stone within the kidney, and it forms sort of like over time, just sort of like an oyster forms a pearl. It starts with a little grain of sand and it gradually gets larger and larger over time, and so our goal is to try to prevent that from actually ever happening or to slow it down if it starts forming.
So how do you know when you're starting to develop a kidney stone?
They can be asymptomatic where you don't feel anything, and up to basically excruciating side pain that starts in your back and radiates down to your groin or your bladder area. And some women who have actually had babies, they'll tell me they'd rather have another baby rather than having another kidney stone, so it can be that painful sometimes.
Really, that painful? And I know men, I've known a couple men who've had them, and they're like, you've never experienced anything this painful in your life.
I've seen grown men cry from a kidney stone.
It's definitely a bad experience. So if people want to learn out some more information, do you have a website they can go to?
They can go to www.adclinic.com. So that's the Austin Diagnostic Clinic. They can go to our website. And so like I tell everybody, prevention is the best thing that we can do. Drinking plenty of fluids. Lemonade is very good also because it has high levels of citrate, and that actually is a very potent kidney stone inhibitor. So those are two simple things we can do.
Great advice. Thank you very much, Dr. Shaw, and we'll have a link to your website on our website, KXAN.com. Thanks for joining us.